A new mystery illness in northern China and Ohio in the US has raised concerns after the COVID pandemic. This is being called a cocktail of influenza, coronavirus, and respiratory syncytial virus, and this time the targets are children. So, what exactly is this new illness? Are kids at India at risk? And what could you do if your child gets infected? Watch to find out. Cases of a respiratory illness in children called white lung syndrome, that is walking pneumonia, have risen globally. Recently, Ohio in the US reported nearly 150 cases of pneumonia, all affecting children with an average age of around 8-year-olds. This surge follows a similar situation in China where 7,000 children were admitted to hospital. So, what is the white lung syndrome? When you see the X-ray or CT scans of the lungs, they appear black. This indicates that there is air in the lungs. Whenever there is an inflammation or collection of fluid in the lungs which restricts the air sacs, the lungs show up white.
White lung syndrome is basically white patches which is visible on chest X-ray or CT scan for pneumonia. So pneumonia, normally when you do an X-ray, it looks like a white, and that's where the name comes from. It is thought that the organisms are the same organism, like SARS virus, some of the COVID viruses as well, influenza virus, they can cause it, and sometimes Mycoplasma pneumoniae and other pneumonia bugs, which normally cause the pneumonia.
So, what are its signs and symptoms? The symptoms include cough, fever, runny nose, phlegm pile up in the sinuses, difficulty in breathing, and fatigue. Is this a new pathogen?
Cause of these illness at the moment are a combination. As I said, they can be combination of influenza virus. Some of them are COVID viruses as well. There are certain bacteria like Mycoplasma pneumoniae. They have also been documented to cause this. So no new virus has come out of it. But in few cases, they have seen that it is a combination of virus and bacteria, or a combination of two viruses. Now, again, this is nothing new. So even in adult population, we see people coming with pneumonia, and we send them on them. If we run a pneumonia PCR profile, we see that different type of more than one viruses can be present. So far, there is no such data that a new mutant strain has come out.
The exact cause of white lung syndrome is still being investigated, but it's believed to be caused by a combination of bacterial, viral, and environmental factors. So here are some precautions that you can take to avoid this. Wash your hands regularly, cover your mouth while sneezing, always wear a mask, and avoid coming in contact with sick people. What can a parent do to protect their child?
Like any other pneumonia, they normally you contract it via the aerosol route, via breathing. So important thing is, if a child is unwell, they should not send them to school. Like any influenza-like illness, water, plenty of fluid, antibiotics should be sufficient. If they go out, they should wear mask. Masking is very important. Like in any other viral illness, masking, if you mask, then you can reduce the transmission of the disease. You know, Mycoplasma is a bacterial infection. You really need to have a good sort of a nutritional value food, high protein content, and prevention is more important. Most of the time, viral illnesses, they get better themselves. They only need a supportive treatment.
Is there any vaccination for this syndrome?
If we know the illness, as I said, that some of the pneumonia are coming from influenza, so there is influenza vaccine already. There are from COVID. Most of the children, particularly if they are in that age group, they can be COVID vaccinated. There is a flu vaccine for H1N1 for swine flu, which we call influenza vaccine. So these two vaccines are already available, and most of the children, if they are eligible for it, get vaccinated for these two vaccines. Apart from that, as long as we don't know the exact organism, if something new comes out, hopefully like COVID vaccine, some new vaccine will come out. But at the moment, there is no evidence to suggest that any new virus has emerged, which is causing this pneumonia, so we don't need to panic.
Are there any particular treatment options that you can consider?
If the patient is not getting better, they should see a pediatrician. Child should see a pediatrician. Most of the time, viral infections don't need any antibiotics because antivirals, particularly if we only use it if we know that this is a particular virus, like a swine flu for that matter, for influenza, we can give antivirals. But most of the time, they are self-limiting. They get better. But any children or adults, if they are getting more and more symptoms, and particularly notice that their oxygen levels are dropping, they should come and seek medical help.
And lastly, is India likely to be impacted by this?
Looking at our previous experiences, we do know that this COVID virus started from Wuhan in China, and in matter of months, days to month, is spread across all over the world. So viral illnesses will always have, because they spread via the environment and via the respiratory route. They are easily transmissible, and ultimately they end up going everywhere. So if we talk about, if we get something new which is cultured and which says that this is some new virus, we need to be careful.
Hope you found this video useful. For more such content, keep watching Money Control.